A very good evening to you there, listener. Welcome to another edition of NCDC Situation Room. My name is Abdul Fattah Otori. It's almost 2 weeks after the historic conference to commemorate 50 years since the first case of Lassa Fever was discovered in Nigeria. It was the first and biggest gathering of researchers and experts working on Lassa Fever from across the world. Well, the Lassa Fever conference has ended, but the conversation continues. So let's join our correspondent, Mobolaji Ajani, in an interview with the Director General, Center for Disease Control, NCDC, Dr. Chikwe Ihekwazu, and the Chief Executive Officer for the Coalition for Epidemic Preparedness Innovations, CEPI, Professor Richard Hatchett. Bolaji, take it from here.
Thank you, Sas, for agreeing to speak with me. Now, I'd like to start with you, Dr. Ihekwazu. The Lassa Fever conference has come and gone, and I congratulate you for a successful hosting of Lassa Fever at 50. Yeah. Now, going forward, sir, we have started to see new cases. What is the next course of action now that the conference is over?
So after this international conference on Lassa Fever, the work continues. We're beginning to see an increase in cases again, slowly. The response work has to start again. But in addition, what this does is push us to the thinking side, to the science. What tools, new tools do we need? What new science do we need? So as we are responding to the acute incident, we're also learning to improve our capabilities, our capacity, our tools in order to better respond to this in the longer term. It's very easy to quickly dive into doing without having the opportunity of sitting back, thinking, reflecting, and changing your approach. And so this time we'll be doing both in parallel.
Now, to you, Professor Hatchett, how was the conference for you? How would you describe the conference?
Yes, no, it's an absolute pleasure. Coming for the Lassa International Conference was a true honor. It was an astounding meeting. Nigerian CDC did a fabulous job, brought together the entire world of investigators who care about Lassa Fever. There's so much momentum, so much enthusiasm coming out of the meeting. I think we're going to see great progress in the fight against Lassa Fever.
Okay, so you spoke on CEPI's role in the opportunity and responsibility for clinical trials in Africa, talking about having a vaccine against Lassa Fever.
Sure.
Now, from your research work, how close would you say we are to having this kind of vaccines?
So I think a vaccine is at least several years away, but I'm very excited to say that the first vaccines against Lassa Fever that have ever been tested in human beings will enter clinical trials in the next month or so. And we expect a number of vaccine candidates to enter clinical trials this year, and we really think we can make progress towards having vaccines that might be ready for emergency use within a few years.
All right. Now, Dr. Ihekwazu, you heard what Richard Hatchett said on the progress already made by CEPI on having a vaccine. They are looking at entering into clinical trials in few months, which may take up to 10 or 15 years, probably, for us to have a breakthrough. So in the meantime, while we wait for these vaccines to happen, what do we do to handle Lassa Fever?
I think what CEPI has actually done is accelerate the research towards a new vaccine. So I don't actually think we're thinking about 10 to 15. I have a much shorter time frame, hopefully, in mind. But at the same time, some of the great research presented at this conference is about how do we optimize the things we already know how to do. Infection prevention and control, limiting transmission in the communities from rodents, understanding better how transmission happens, understanding how the diagnostics happen, optimizing diagnostics, making it easier to use and easier to implement. So there's a lot we can do, and that's the work that starts immediately in terms of improving how we use the tools that we already have.
Okay, so final one to you, Professor Hatchett. What would you advise we do as a country, knowing that we bear a very large burden of this disease?
We're eager to work with the Nigeria CDC and the government in the fight against Lassa Fever. I think it will be critically important for the people of Nigeria to understand Lassa Fever, to know that it's a big problem, that it's an underestimated problem, and we hope that they will welcome us. We look forward to working with the people of Nigeria to beat this disease.
Well, I want to thank you very much, Professor Richard Hatchett, CEO, Coalition for Epidemic Preparedness Innovations, CEPI, for speaking on NCDC Situation Room.
It's a pleasure. Thank you for the time.
And also a very big thank you to you, sir, Dr. Chikwe Hiekwazu, DG NCDC, for your time on the program, sir.
Thank you. Always a pleasure.
Wetin be this Lassa fever while they hear up and down so?
This na disease wey Lassa fever virus dey cause. E dey happen when person touch another person or rat wey carry this virus, poo-poo, wee-wee, spit or even blood, and e no dey send age o.
How fit take no person wey carry Lassa fever sef?
The sign dey show 2 to 21 days after person touch another person or rat wey carry this virus. Dem fit dey catch cold or weak or get body pain or sore throat or dey vomit plus purge or cough or make their body no dey fit stay one place or make face swell up or make blood dey comot from any part of the body. Person wey get Lassa fever fit be like say na any other disease.
How we fit take stop this Lassa fever?
No near rat, dead or alive. Keep your house plus area clean. Store water plus food where rat no go reach am. No spread food for road or even open place. Dey careful with the person wey get Lassa fever or the one wey Lassa fever kill. Make sure say you follow wetin government talk before you bury am o.
Dem fit treat this Lassa fever?
E better make you treat am early immediately you notice am. So no waste time o. Go the hospital wey dey near you immediately you begin get the sign.
Thank you very much, Bolaji, for that interview. I'm sure we'll have you again before the close of the program for more. But at this point, we'll take a message from our drama group. When we return, we'll join Godwin Odemije in the Situation Room for updates. Stay with us.
Chief Adisa.
Yes, I am here with you now.
Of course, I know you are here with me. Look, my mind is just going through all that transpired during the conference of that Lassa fever.
Your mind must be hitting on the good and the bad that was revealed at that event.
Yes.
That gathering was one too many. Ogadu.
Yes. But it brought out the best in every of us. That's if you ask me my personal opinion.
I really do not need to ask you, because it is common knowledge that the meeting achieved the purpose for which it was called, even beyond measure. Well, one sincerely hopes we won't have to wait for another 50 years before we hold another one.
Okay. Haba, that time would have gone. Yes.
Gone where?
Diamond. Oh, you want to be here another 50 years?
Iku, out you. I don't want to die now. You run you. Please, do not even mention death near where I am. Ikubawo.
You can like nobody want to die, but want to go to heaven.
No.
You too dey fear. You don't want to die, but do you know that people are dying of Lassa fever in this community unannounced?
Usman, it is true. You are correct. People are dying,
and very little is being done about it. But
and that is what made the old professor to break down in tears.
Break down. Point of correction. He did not break down. He only cried. I saw him crying. I don't like fake news.
Crying.
I don't like it. I don't like it. What kind of this is that?
So this is where you people gathered. It appears you like sitting under this mango tree most of the times.
Yeah, sometimes.
Chief Adisa, I greet you and...
I greet you too, Jare. Good man. Jare. You see, staying under the tree brings you closer to nature. You get the best of the freshness of the air. And it sinks uninterrupted into your body.
Always you're cool. That is very true. Chief Adisa, you know you are very humorous. The only time I don't pray to encounter you is when you are angry, sir.
Mike, even the lion has his peaceful moments. So it is allowed to get angry or mad at least 2 minutes in a day.
Malam Usman, what is the matter? You are unusually quiet and solitary. Has anyone annoyed you?
Yes. This man over here with this BID.
Me?
Yes, me. Okay?
Yes. What did I do now?
That's how you annoyed me. Look, doctor, you know me. I'm an honest and very responsible somebody.
Yes,
I don't like fake news. How can you say the old professor broke down, whereas the old man only cried? That is fake news. You were there by yourself.
Is that?
Did he break down?
Oh, Malam Usman. Going by what you just said now, you are all saying the same thing.
Hold
on. You see, Chief Adisa is not entirely wrong when he said he broke down. You see, We all saw what happened. That man was so moved with pity for those dying of Lassa fever and absence of health facilities in most of those areas. And that was why he broke down.
Okay,
break down,
cry.
Yes,
Next time, use the appropriate one for the appropriate somebody.
Break down.
Actually, it's very touchy. Look, because of that, I am going to meet my local government council chairman. He must do something about Lassa fever in this our community. Wallahi. Look at our hospital here. It's just like for the connection. It is not even equipped to handle this deadly disease. Wallahi,
Usman, even with hospital, the oga of that neighboring community still lost his son. Those rats are not joking, and we too must be ready for them, Neo.
Oh, is it? Well, Madam Usman, you were very right when you said you were going to meet the local government council chairman.
Yes.
They need to actually know that this disease has no respect for anyone.
Doctor, are you telling me? I have seen it now.
Doctor, I am thinking it's not just the local council chairman we should talk to. The state governors, Papa, the commissioners, the minister, anybody that is involved in this thing, we must talk to them.
Yes, that's true. Always Yoku. And as we are putting the recommendations of the conference together, let us all say no to Lassa fever by doing the right thing. See, do not allow refuse around your house. Do not share your apartment with rodents. No self-medication. And report any ailment to the hospital. It could be Lassa fever.
Thank you very much for staying right here with us, and you too can be a part of the conversation. Let's know your opinion on Lassa fever. Please reach us. We're on Twitter. The handle is at ncdcgov. You can call us or send a message on 0812 222 2081. That is 0812 222 2081. You can also reach us via a toll-free line, meaning you don't pay when you call, and the number is 0800 9700 0010. 0800 9700 0010. We expect to hear from you. Thank you. Now at this point, let's join Godwin Odemija in the Situation Room. Godwin, we hear the number of cases are rising yet again.
Well, thank you very much, Abdul. Indeed, there has been an upsurge in the number of people coming down with Lassa fever. In the reporting week 3, that is between January 14 to 2019, 74 new cases were confirmed. From 1st to 20th January 2019, a total of 377 suspected cases have been reported from 9 states. Of this number, 136 were confirmed positive, with 31 deaths. That is about 22.8%. In this reporting week 3 also, 1 new health worker was affected in Ebonyi State. So against the background of the new outbreak, in the Situation Room today, we featured Dr. Sylvester Okugbeni, the Chief Medical Director, Irua Specialist Teaching Hospital. Dr. Okugbeni, thank you for joining us.
Thank you very much.
So, in seeking the way out of this current outbreak, what will you say we are doing in terms of case management, knowing that Irua Specialist Hospital is in the forefront of managing the Lassa fever cases in Nigeria?
One is to tell you that diagnostics now are very reliable and very regular. You can be rest assured that when we give you a test and we say it's positive, that's very correct. And when we say it's negative, it's correct. That's one of the things. I think the other thing is that we've been able to decrease mortality in the patients who present with Lassa fever by specific interventions. Renal dialysis is now regular. This year we're introducing ventilation and blood products because the aim really is to decrease the mortality to a single digit, and we really hope to achieve that. And then on a larger scale, supplies are more regular, they're more frequent, and now we get prepared for the epidemic. We don't wait for the epidemic to occur before response. We get prepared for the epidemic. Supplies are on the ground. The isolation ward is kept waiting. And so once the epidemic starts, we are able to just continue to respond without any panic measures.
Now, the cases recorded in 2018 were about the highest in the history of Nigeria. Unfortunately, 2019 has started with quite a number too. What are we doing to ensure a better handling of these cases this time around?
2018 was the largest epidemic we've seen. We did some investigation into that to try to find the cause why that was large. Of course, we now know that it wasn't mainly human to human, it was mainly rat to human. That was very good to know, so that efforts can be directed in preventing rat to human contact. And I think a lot is being done to achieve that. We're also looking at things that can help us decrease the number of people that come in. Surveillance is much better, contact tracing is much better, and we just hope that 2019 is going to be better.
Now, Dr. Okugbehi, don't you think having just 3 centers managing Lassa fever is insufficient for a country as big as Nigeria?
IRWA did not achieve its status overnight. We've had the institute for 10, 11 years now, and I think there's going to be a gradual increase in the total number. Now we have 3, and that's the largest you have in the whole of West Africa in any one country. And I think the other 2 are doing very well. They are building and capacity, both for diagnosis and treatment. And don't forget that there are other centers that also treat Lassa fever. Although we say these are the 3 main centers, it can be treated in Luth, in National Hospital Abuja, and all we need to do is continue to scale up the centers. And I think in time we will achieve that.
Dr. Okugbehi, as a medical doctor, what is it like contending with this disease on a daily basis?
Thank you. That's a very important question. You know, in 2018, we had a few health workers who got infected, and that's very worrisome. And so part of what we did was to do a lot of training through the 6 geopolitical zones. I was in the National Association of Resident Doctors annual general meeting, where we also gave some education on preventing the health worker infection. Now, when we go to work every day, and that really is the learning point, the infection prevention control measures should become a routine, not just done only when there's an epidemic. It should become a routine. Once we're able to establish that, and then I think that will really bring down the level of health workers' contacts. And that's why I say, in our Institute of Lassa Fever Research and Control, for the past 10, 11 years, none of the staff who work there have contacted the virus. And that's because they maintain a high level of infection prevention control. And what we are saying is that that should be the routine for every staff in every part of the hospital and in all hospitals of Nigeria.
Thank you very much for speaking with us on the program.
Thank you very much.
Wetin be this Lassa fever wey dey hear up and down so?
This na disease wey Lassa fever virus dey cause. E dey happen when person touch another person or rat wey carry this virus poo-poo, wee-wee, spit or even blood, and e no dey send age o.
How fit take know person wey carry Lassa fever sef?
The sign dey show 2 to 21 days after person touch another person or rat wey carry this virus. Dem fit dey catch cold or weak or get body pain or sore throat or dey vomit plus purge or cough or make their body no dey fit stay one place or make faces swell up or make blood dey comot from any part of the body. Person wey get Lassa fever fit be like say na any other disease.
How we fit take stop this Lassa fever?
No near rat, dead or alive. Keep your house plus area clean. Store water plus food where rat no go reach am. No spread food for road or even open place. Dey careful with the person wey get Lassa fever or the one wey Lassa fever kill. Make sure say you follow wetin government talk before you bury am o.
Dem fit treat this Lassa fever?
E better make you treat am early immediately you notice am. So no waste time o. Go the hospital wey dey near you immediately you begin get the sign.
Thank you very much, Godwin Odemije, for filling us in on that. Now, still talking about strategies to ending Lassa fever in Nigeria, let me hand you over once again to Mobolaji Ajani to take us through a conversation he had with one of the plenary presenters at the Lassa Fever at 50 conference, Professor Christian Happi, Director, Africa Center of Excellence for Genomics of Infectious Diseases, Redeemers University, Ede. Mobolaji Ajani caught up with him at the Lassa at 50 conference in Abuja. It's over to you, Bolaji.
Professor Happi, thank you so much for speaking with us today.
Thank you.
Now, you have been in the forefront of research into infectious diseases in Africa, which Lassa is part of. Now, rising from the Lassa Fever at 50 conference, what would you say our focus should be looking beyond the talks?
Well, I think, there's a lot of scientific progress, but I think now there's a gap between scientific progress and then investment in science. And then I think the challenge is going to be whether the Nigerian government or the African governments are actually ready to put money where their mouth is. I think I've said it before, and I think it's important for now to leverage the scientific progress and then translate those scientific progress into tools that can actually effectively eradicate Lassa fever. That's where the challenge is. And I'm hoping that, with the recommendation from this conference, they can make enough investment in terms of developing new technology, in terms of adapting new technologies and encouraging further scientific development into tools that actually will help eradicate Lassa fever.
All right. Now, we have about 4 laboratories doing the diagnostics now. That's one area that I'm very sure you are passionate about. So, talking about rising to the challenge, the theme of the conference anyway, would you say these laboratories are enough to handle the response?
These laboratories are not enough. Nigeria, you have 4 laboratories for 200 million people. I don't think 4 laboratories are enough. I think even if you had 20 laboratories in Nigeria, that would not be enough. But I think the question is just a number. The question is also the quality and then equipping the facility with a state-of-the-art equipment. I think that's the bottom line. Do we have adequate personnel? Are the personnel qualified enough in order to respond to the outbreaks? So these are questions. I think it is not necessarily a number. It is also a game of ensuring that we have enough facilities in order to respond to rise to the challenge. And clearly, I think 4 laboratories are not enough, and I don't believe that even 20 in Nigeria will be enough.
All right. Now, let's talk about the capacity we have in Africa, in Nigeria. Would you say this is good enough to say that in a few years from now we can end Lassa fever?
We've made progress, definitely. We went from almost nothing to something, but I think that something is not enough. I think we need to do more. And I recommend that the government actually put more resources in order to, stem the tide of all this of Lassa fever and other infectious diseases. I don't believe that we should pride ourselves for what the kind of progress that we've done now, because we could have done better.
So let's look at the conference itself. What would you say is a take-home from this conference for you as a scientist?
Well, I think the take home for me is that there's hope in the future. I've seen good science from Nigerian scientists. I've seen a lot of progress scientifically, both from the vaccine end, both from the diagnostic end, and then also from drug development end. So, and I also believe that there's also a lot of local capacity that is being built. And for me, I think it is a message of hope that I'm taking back from here. But at least that has to be sustained. I just hope that after the conference, we're not going to be excited and then let everything fall, because eventually things are going to be worse than they'll ever be. So I think it is time to sustain this momentum and then use the momentum actually so positively, so that in the end, we can say that, okay, the conference on its own was successful, but again, that success did not end and did not transform into failure, but that success actually transformed into something very positive.
Finally, Prof, the possibility of having a vaccine, which we all believe or trust that it could be the game changer. Are you optimistic that in a very short while we could have?
I'm pretty optimistic for vaccine, because I'm a member of the Scientific Advisory Board of CEPI, and I've seen a number of vaccine candidates that could be very promising. And I have a strong belief that in the next 10 years, we should be able to have an effective vaccine against Lassa fever.
10 years is a long time, sir.
Well, because you need to go through vaccine trials. It's going to take another 5 years to actually do some clinical trials, and then you got post-marketing, and then, there are just so many regulations for you to say, okay, well, you have a vaccine. So the vaccines actually many of them are being developed. Now they're at the stage of clinical trial. So the clinical trial, I think they will start by 2022, and then that's about 3 years from now, and it may take another 3 years, for instance, to complete the trials and then make all those analysis. But what happened to actually post-approval? So that's why I put 10 years. So I think clearly, when I say 10 years, it's actually at a stage where we say, okay, well, we have vaccines, and then they're all certified, they go through the regulatory process. I think we should be very optimistic. It's taking malaria almost 50 years of doing different kind of vaccine to achieve. So, and we still don't have an effective malaria vaccine. So if you have a Lassa vaccine in the next 10 years, I think that is very positive.
So what should we be looking at within this short period while we're waiting for the vaccine? What should we do?
Well, we still continue to develop mechanisms of protection. So outreach, reaching out to communities, protecting, preventing, putting in place, preventive measures, and then also continue to develop science. Deploy rapid diagnostics in the field, and then also do a lot of advocacy at population level.
A very big thank you to you, Professor Christian Happi, Director, Africa Center for Excellence for Genomics of Infectious Disease, Redeemers University. Thank you for speaking with us on the program, sir.
Thank you. I appreciate it.
Wetin be this Lassa fever wey dey hear up and down so?
This na disease wey Lassa fever virus dey cause. E dey happen when person touch another person or rat wey carry this virus poo-poo, wee-wee, spit or even blood, and e no dey send age o.
How fit take know person wey carry Lassa fever sef?
The sign dey show 2 to 21 days after person touch another person or rat wey carry this virus. Dem fit dey catch cold or weak or get body pain or sore throat or dey vomit plus purge or cough or make their body no dey fit stay one place or make face swell up or make blood dey comot from any part of the body. Person wey get Lassa fever fit be like say na any other disease.
How we fit take stop this Lassa fever?
No near rat, dead or alive. Keep your house plus area clean. Store water plus food where rat no go reach am. No spread food for road or even open place. Dey careful with the person wey get Lassa fever or the one wey Lassa fever kill. Make sure say you follow wetin government talk before you bury am o.
Dem fit treat this Lassa fever?
E better make you treat am early immediately you notice am. So no waste time o. Go the hospital wey dey near you immediately you begin get the sign.
And that's the size of the program NCDC Situation Room today. We thank you for being a part of the program. We also hope that you'll join us again next week. If you want more explanation on what you have heard today, or you just want to know about the Nigeria Center for Disease Control, kindly reach us on Twitter at NCDCGov. You can call or send a message on 0812 222 2081. If you prefer a toll-free line, then the number is 0800 9700 0010 0800 9700 0010. We expect to hear from you. The program is a production of Gado Agency Limited under the sponsorship of the Nigeria Center for Disease Control, NCDC. Visit their website to know more. It's www.ncdc.gov.nj. The executive producer is Godwin Odemije. He also wrote the drama story. Mobolaji Ajani is the producer of the program. And I am Abdul Fattah Otori. Please let us all say no to Lassa fever by doing the right thing. Do not allow refuse around your house. Do not share your apartment with rodents. No self-medication. And report any ailment to the hospital. It could be a Lassa fever case. Bye for now.